everyone, we're senior dental hygiene students in term 6. Today, our recording is going to be done by Olivia, Kristen, Alyssa, and myself, Shauna. Thank you for taking the time to listen to our recorded lecture. We are really excited to share our knowledge about mouth care with you. In our clinical placements, especially in our long-term care settings, we've seen how important oral health is for overall health. Many clients we work with are elderly, bedridden, or have conditions like Alzheimer's or stroke-related impairments. We provided mouth care in real-world settings so we understand the challenges, and we're here to give you simple, safe, and effective techniques so you can help with your clients.
Why is mouth care important? Mouth care is important because proper oral care removes plaque bacteria that sticks to the teeth and gums. It helps prevent infections in the mouth. These infections can often spread to the rest of the body if not managed. Poor oral care can seriously affect overall health. Bacteria can enter the bloodstream and impact the lungs, heart, and even blood sugar levels. Maintaining oral hygiene also supports a person's comfort, dignity, and confidence. It's essential for eating, speaking clearly, and feeling comfortable in social situations. The oral systemic link. Your mouth is connected to the rest of your body, so what happens in the mouth doesn't stay in the mouth. Bacteria that build up on the teeth, gums, and tongue can travel to other areas of the body through the bloodstream or airway, leading to serious health problems. Let's break down how this works. Diabetes. There's a two-way relationship between diabetes and oral health. If there's an infection in the mouth, like gum disease, it can make it harder to manage blood sugar levels. In turn, high blood sugar levels can reduce the body's ability to fight infection and slow down healing in the mouth. So a client with diabetes needs even more attention to oral care. Heart disease. When harmful oral bacteria enter the bloodstream, they can stick to the walls of blood vessels and increase inflammation. This may contribute to a blockage that causes heart attacks or strokes. Clients with existing heart conditions are especially at risk. Lung infections, including aspiration pneumonia. This is a major concern in long-term care. If a client has a lot of bacteria in their mouth and accidentally swallows or inhales it, especially when laying down, or if they are having swallowing difficulties, it can get into the lungs and cause a serious infection. Aspiration pneumonia can be life-threatening, especially in older adults. So as a PSW, you play a vital role. Helping clients with daily mouth care isn't just about fresh breath. It's about protecting their whole body's health and preventing serious medical conditions. Plaque is something we see every day in oral care, even though we can't always see it right away. It's a soft, sticky film of bacteria that constantly forms on the teeth, gums, tongue, and even on dentures. It starts off clear and is almost invisible, which makes it easy to overlook. But if it isn't brushed off or cleaned away daily, it quickly builds up and becomes a more visible white or yellowish coating, sometimes even looking fuzzy or filmy. This layer of bacteria doesn't just sit there, it feeds on sugars in the food we eat and produces acids that can damage the teeth and irritate the gums. If left untreated, plaque can cause a number of problems like bad breath, gum disease, tooth decay, and infections. In terms of infections, if the plaque isn't managed, especially in clients with weakened immune systems, this bacteria can enter the bloodstream or lungs and lead to serious infections. As PSWs, recognizing plaque and understanding how quickly it builds up is essential. Your support in providing or encouraging daily oral care, like brushing, flossing, cleaning dentures, can make a major difference in preventing these issues and protecting clients' health and comfort. So, what is dental decay? Dental decay, also known as tooth decay or cavities, is damage to the tooth structure caused by plaque, bacteria, and sugar. When we eat or drink something sugary, the bacteria and plaque feed on that sugar and produce acid. That acid starts to eat away at the tooth enamel, which is the hard outer layer of the tooth. Over time, this creates holes in the teeth called cavities. These cavities can be painful, especially when eating or drinking, and if not treated, they can get worse and eventually lead to tooth loss. The good news is that dental decay is largely preventable with good daily care. Here's how we can help prevent it. Encourage or assist with brushing twice a day using fluoride toothpaste. Fluoride helps strengthen the enamel and makes teeth more resistant to acid attacks.
Help clients limit sugary snacks and drinks, especially sticky or frequent snacks which give bacteria more fuel to make acid. Promote regular dental checkups and professional cleanings, even for clients in long-term care. Remind or assist with using fluoride and mouth rinses when needed to remove plaque from between the teeth and areas the toothbrush can't reach. So by supporting these simple habits, you can play a big role in helping clients avoid pain, keeping their teeth longer, and maintain a better quality of life.
Now, let's talk about gum inflammation, which is something PSWs may notice during daily care. The most common cause of gum inflammation is plaque, also known as a sticky film of bacteria that forms on the teeth every day. If plaque isn't removed with proper brushing and flossing, it hardens into tartar, which can't be removed by brushing alone. When plaque and tartar sit on the teeth, the bacteria release toxins that irritate the gum tissue. This triggers the body's immune response, leading to inflammation. You'll often see red, swollen gums that bleed easily, especially when brushing or eating. These are classic signs of gingivitis, the early stages of gum disease. If gingivitis isn't treated, the inflammation can spread below the gum line and begin to damage the structures that hold the teeth in place, such as the ligaments and the jawbone. This is a more serious form of gum disease called periodontitis. Over time, it can cause teeth to loosen or even fall out. As a PSW, you might be the first to notice signs of bleeding gums or changes in a client's mouth. Early detection and daily oral care can prevent gingivitis from progressing and protect the client's overall health.
Let's take a closer look into gingivitis, which is the early stage of gum disease. At this stage, you might notice red, swollen gums that bleed easily, especially during brushing or flossing. These are the first signs that something isn't right. It happens when plaque buildups on the teeth and isn't removed through daily oral care. The good news is there's no bone loss or tooth mobility yet, which means the teeth are still stable in their socket. Gingivitis affects only the surface tissue of the gums, not the deeper structures that support the teeth. And most importantly, gingivitis is reversible. With proper daily brushing, flossing, and regular dental cleanings, the gums can heal and return to a healthy state. As PSWs, your role is in assisting with or encouraging proper oral hygiene can help stop gingivitis in its tracks before it becomes something more serious.
Let's talk about periodontitis, which is an advanced stage of gum disease. At this point, the inflammation has moved beyond the gums and is now affecting the bone and connective tissues that hold the teeth in place. You might notice gum recession, where the gums pull away from the teeth, along with loose teeth or even signs of pus or infection around the gum line. Unlike gingivitis, periodontitis causes permanent damage. The bone and tissue that are lost can't grow back on their own. That's why this stage is considered irreversible and must be managed by a dental professional through cleanings below the gum line, medications, and even surgery. Your role as a PSW is essential here. If you notice signs like loose teeth, persistent bad breath, swollen or receding gums, or any discharge, it's important to report them early. Prompt dental care can help manage the disease and slow its progression.
Mouth odors, also known as bad breath or halitosis. This is a common issue and one that can be uncomfortable or embarrassing for clients, but it's also often preventable. The main cause is bacteria in the mouth. These bacteria feed on leftover food particles and produce a smelly gas as they break them down. When the proper oral hygiene isn't followed, not like brushing, flossing, or cleaning dentures regularly, plaque and bacteria build up, which increases odor. Another big contributor is dry mouth. Saliva naturally helps clean the mouth and wash away food and bacteria. If someone has dry mouth due to medications, dehydration, or breathing through their mouth, there's less saliva and the bacteria are more likely to thrive, leading to worse breath. As a PSW, you can help reduce mouth odors by encouraging or assisting with regular brushing, flossing, and denture cleaning, promoting hydration, and reporting signs of persistent bad breath, which could point to an infection, gum disease, or other health concerns. Mouth odors and systemic conditions. Certain health problems can affect the breath smell too. It is important to know that bad breath isn't always just about oral hygiene. Sometimes certain health problems can change the way a person's breath smells, and this can give clues about their overall health. For example, with conditions like diabetes, especially while not well controlled, can cause a sweet or fruity smell on the breath. This happens because a condition called ketoacidosis, where acids called ketones build up in the body, causing that fruity smell in the mouth. Sinus infections or respiratory infections can cause or produce a musty or foul odor in the mouth due to mucus and bacteria trapped in the nasal passages. People with GERD or acid reflux may have a sour or acidic smell on their breath because stomach acid is coming up into the throat or mouth. In kidney failure, breath can sometimes smell fishy, like ammonia, because waste products build up in the body when the kidneys aren't working properly. Liver disease may cause a sweet, musty, or fecal odor due to the liver's reduced ability to process toxins. Tonsillitis or tonsil stones, which are small, hardened debris stuck in the tonsils at the back of the mouth, throat, can cause a putrid sulfur-like smell because of trapped bacteria. As a PSW or PN, noticing unusual breath odors and reporting them can help catch these health issues early and ensure clients get the care they need. Identifying abnormalities. When providing care, it is important to keep an eye out for any abnormalities in the mouth. Early detection can make a big difference. Here's what to look for. Sores or ulcers. Watch for any sores that bleed easily or don't heal within 2 weeks. Persistent sores can be a warning of something serious and should always be reported. White or red patches. These can appear anywhere in the mouth. White patches are called leukoplakia. Red patches are erythroplakia, and sometimes there are mixed white and red patches known as erythroleukoplakia. These changes might indicate abnormal cell growth and need professional evaluation. Lumps or thickening. Feel for any lumps, bumps, or areas where the tissue feels thicker. These can show up on the lips, gums, tongue, cheek, or on the roof of the mouth. Texture and color changes. Notice any rough or crusty areas or patches that look gray, dark red, or white. Best to keep an eye out and see if it changes within 2 weeks. Other signs. Be alert to unexplained bleeding, numbness, tenderness, pain, or swelling in the mouth or jaw. As a PSW or PN, if you see any of these signs during oral care or daily checks, it is important to report them promptly. Early identification helps ensure clients get the care they need as soon as they possibly can, and to monitor any abnormalities or changes in the mouth for 2 weeks just to see if any changes occur and to report the client's physician or dentist if applicable. Continuing with abnormalities, where to check. When checking the mouth for any abnormalities, it is important to examine all key areas carefully. Here's what to look for and what to do. Lips. Look at both the outside and inside of the lips. Check for any sores, lumps, or unusual patches. Gently feel the lips for any bumps or tenderness. Tongue. Examine the top, sides, and underneath of the tongue. Look for any changes in color, ulcers, or lumps. Use gentle pressure with your fingers to feel for any abnormalities on the tongue's surface. On the gums. Inspect the gums closely for any patches, sores, or swelling. Run your finger along the gum line to detect bumps, rough areas, or tenderness. Cheeks. Pull the cheek outward to get a good view of the inside. Look for ulcers, patches, or thickened areas. Use your finger to feel for any lumps or sensitivities on the inside of the cheek. Roof of the mouth, also known as the hard and soft palate. Tilt the client's head back and ask them to open wide. Check for any changes in color, texture, ulcers, or growths. Gently feel along the roof of the mouth for irregularities on the floor of the mouth. Have the client lift their tongue to expose the area underneath. Look for color changes, swellings, or lumps. Press gently in this area to feel for anything unusual. If you notice anything in these areas, Please monitor it for 2 weeks, and if any changes occur, please refer to the client's physician.
Let's look how to effectively remove plaque bacteria. First, client positioning. If the client is in a wheelchair, sit behind or beside the client while supporting your head. If the client is bedridden, turn the head to the side and use a towel and gauze to catch any fluids. 2. Toothbrushing. Use a soft toothbrush at a 45-degree angle to angle in towards the gums. Use gentle circular motions. Manual is great, but power brushes are fine if the client is able to tolerate them. Modifications. Homemade handles such as tennis ball and foam grips can help clients with dexterity issues grip the toothbrush easy. Secondly, use gauze or swabs for unconscious clients. Interproximal care. Instead of floss, use soft picks or epoxy brushes. Clean between the teeth gently. And lastly, tongue cleaning. Use a toothbrush or a damp gauze if the tongue scraper is no longer available. This will help with bad breath, or also known as halitosis, to remove any bacteria left on the tongue. When it comes to assisting in brushing and flossing with a client, there's a few key pointers. When assisting a client with brushing, ensure there's proper lighting and positioning in place. Provide encouragement and communicate what you're doing with the client. Support the client's hand if they want to help but can't manage the full task. Gently brush all surfaces, being mindful of any sore spots or loose teeth they may have. For interproximal cleaning, also known as in between the teeth, use proxy brushes or soft picks instead of floss, which is more difficult in a caregiving setting. Insert gently, clean, and remove without forcing it. Demonstrate and encourage PSWs to let the clients try when appropriate. And most importantly, always observe the client's response. If they show discomfort, adjust the technique to them.
Let's go over the essential tools you'll use to provide effective oral care. Toothbrushes. Use a soft manual toothbrush to gently clean teeth and gums without causing irritation. Power brushes can be very effective and are great if the client tolerates them well. For clients with limited hand strength or coordination, toothbrushes with modified handles like tennis ball grips make holding and controlling the brush easier. Toothpaste. Always choose fluoride toothpaste to help protect against cavities. For clients with sensitive teeth or gums, use non-whitening, non-abrasive formulas to avoid discomfort. Xylitol products. Xylitol gum or mints can help reduce cavity-causing bacteria and stimulate saliva. Use these with caution and watch for any digestive upset, as some people may not tolerate xylitol well. Denture cleaners. Clean dentures daily using a denture brush with mild soap or denture-specific cleansers like Polydent or Renew. Avoid using regular toothpaste on dentures as it can be too abrasive. Interdental cleaners. Use soft picks or proxy brushes to gently clean between teeth where a toothbrush can't reach. For swabs and gauze, for clients who are unable to brush normally, use Toothettes, foam swabs, or 2x2 gauze pads to gently wipe oral tissues and clean the mouth clean. Lip care. Keep cleans moist and comfortable by applying water-based lubricants or plain petroleum jelly like Vaseline. This prevents cracking and soreness. Using the right tools and adapting to each client's needs helps maintain their oral health and comfort. When providing oral care to clients who are dependent on or have limited ability to assist, it's important to be gentle, safe, and respectful. Turn the client's head to the side to help prevent fluid from entering the airway and reduce the risk of aspiration. Use minimal water during brushing. Dip the toothbrush lightly or use moistened foam swabs to avoid excess fluid buildup. Use gauze or foam swabs to gently clean the gums, cheeks, tongue, and palate, especially if the client can't tolerate a toothbrush. If the lips or oral tissues are dry, apply a moisturizing gel or water-based lubricant to keep them comfortable and prevent cracking. Use a suction device if available to remove excess fluids or use gauze to gently absorb saliva and water. Never leave the client unattended during oral care to ensure their safety.
Always talk to the client while providing care, even if they are unconscious. Speaking preserves their dignity and helps you stay focused and thorough during the process. Following these steps helps maintain oral hygiene safely and respectfully for clients who need assistance. The important steps for daily denture care to keep your client's dentures clean and comfortable. So first, you're going to want to remove and clean daily. It's important to take dentures out every day. This gives the mouth a chance to rest and reduces the risk of irritations or infections. You're going to want to brush with a denture brush. So use a soft denture brush along with a non-abrasive denture cleanser specifically designed for dentures. Avoid regular toothpaste as it's too abrasive and can cause tiny scratches on dentures. And then you're going to want to gently brush all surfaces of the dentures to remove food particles, plaque, and stains. And then soak overnight. After cleaning, place the dentures in a denture soaking solution overnight. This keeps the dentures moist, prevents warping, and helps remove bacteria and stubborn stains. Rinse before wearing. Always rinse dentures thoroughly with water before putting them back into the mouth, especially after soaking. This removes any remaining cleaning solution that could irritate the gums. When caring for clients with dentures, it's important to recognize some common conditions that can develop in the mouth, such as denture stomatitis. This shows up as a red, inflamed tissue underneath the dentures. It's usually caused by irritation from the denture or a buildup of bacteria and yeast. Then we have angular cheilitis. This condition causes cracks or sores at the corners of the mouth. It's often related to fungal infections and can be uncomfortable. Then we also have candidiasis, known as oral thrush. This can appear as white patches inside the mouth, which can be painful or cause a burning sensation. It's caused by an overgrowth of yeast and is more common in denture wearers. There are also some less common conditions to watch out for, such as epilis fissuratum. This happens when an ill-fitting denture causes excess tissue to grow, usually between the cheek and the denture. It can cause discomfort and swelling. Then we have papillary hyperplasia. This condition appears as small bumps or a cobblestone look on the palate, which is the roof of the mouth. It's rare but can be caused by poor denture fit or wearing dentures constantly without breaks. Recognizing these conditions early means your client can get timely treated and avoid further discomfort or complications.
Thank you so much for listening in on our presentation today. Always remember, oral care is not just about a clean mouth, it's about overall health, dignity, and quality of life. As PSWs, you always play the vital role in preventing infections and complications, supporting nutrition, communication, and comfort to your patients, as well as promoting confidence and self-esteem. Your daily efforts make a lasting difference. Let's always continue to prioritize oral care as a key part of compassionate, person-centered care. Thank you so much.